I have a great time with my life, and I want to share it.
Good morning, guys. It has been a couple of days that I have started my inpatient rotation for physical therapy, and during that period I have learned a couple of stuff that I didn't know before I joined the clinic, and I wanted to take an opportunity to share this experience with you guys so that you don't have to face difficulties that I did. But before that, let's just go to the gym. Alright, let's get some breakfast.
Just got here. Obviously the patient's privacy is going to be the most important thing, so I'll see what I can film without compromising anyone's privacy or confidentiality. I'm super excited for today.
Okay, everyone. I came back from my rotation at around 3:30 this afternoon, and I thought, I'll take a couple of minutes nap, maybe about 25-30 minutes nap, and I'll get back to studying. I wake up and it is 7:55, so I almost took 4 hours long nap. I was like, oh shit. Anyways, today was good. I will go over some of the things that I did well and some of the things that I wish I could do. I wish I had done well today in a few seconds, but let's shop some stuff first. So one thing I'm going to do to ensure success in this rotation is every time I hear something from my CI or from anywhere that I am not sure what it is, even if I have heard about it, but if I feel like I have heard something that I really can't explain it to a layman, then I'm going to write it down in this notebook and do my research about it so that I'm more confident in that topic. So, without wasting any time, let me talk about the 5 things that really surprised me. First, shoes. Day 1, I wanted to dress to impress. I was dressing professionally, good looking shoes. Big mistake. I had to walk so much going from one patient's room to another, running around from one floor to the another. that by the end of my shift, my feet were just killing me, right? And I was so tired by the end of the day, and the foot hurts with all that walking. So number one, get yourself really comfortable shoes, regardless of how cool they are or how cool they don't. Second thing, same along the lines of the dress code. When I got an email a couple of days back from one of the supervisors, she told me that I could wear, polos, professional looking polos, and I did that. Your boy got, wore the best looking polo that I owned. And what happened was, what I didn't realize is that the temperature in the hospital is so freaking cold that in mid-July, when there is, when it is 100-degree outside, I would be freaking shivering inside the hospital. Whole day, I was tired because my feet would hurt of walking around in that fancy-ass shoes, and I would shiver at the same time. I was miserable the whole day, and everybody in the department, they were wearing some sort of full sleeve t-shirt underneath their polos. Nobody really told me. I should have figured it out. I didn't. That was stupid of me. But anyways, tip number 2, wear something that will prevent you from shivering like crazy. The next thing on my list, the software. If you have been to any outpatient clinic, you know that softwares can be glitchy, they can be overwhelming, and they can be pretty frustrating. Now, take that frustration and multiply that by 5. And that's the amount of frustration that you'll feel when you are using a software in the acute rehab or a hospital. The amount of information that was there, the things that you had to maneuver to get the things that you want, is ridiculous. Especially on the day one, and sometimes your CI doesn't really realize this is your first time using that software, and sometimes she just instructs you do this, and this. By the way, I do not know if my camera is focusing. And hopefully it's in focus. So anyway, if your CI doesn't really understand how frustrating the experience can be, you, my friend, you are screwed. And that's what really happened to me, right? My CI was super nice, super helpful, but she wasn't particularly good at giving me a proper instruction when it comes to teaching me how to use that software and just finding the stuff that I need to find. Extremely frustrating. Extremely surprised how they still use that kind of software. Number 3, software. Don't really know what you can do about it though. So, as you have figured out by now, documentation is one of the important things that you need to really be good at, right? It is the thing that's going to save your butt 5 years from now, 10 years from now, 20 years from now. And there's a saying that if you didn't document, you didn't do it. Now, we all know that. What's new about it, right? When you are in an outpatient clinic, and I was in an outpatient clinic, I have never been to a hospital, which is why I am making all these stupid, mistakes and, the pointers that I'm giving to people that have never been to a hospital, like me. But anyways, you would realize if you have looked into documentation from a hospital perspective, you have to realize that there are a million different departments, right? Radiology, labs, doctors, notes from nurses, and other technicians, whatever. OTs, surgery department. Millions of departments, and they all write their documentation. You as a PT, you really need to know what information you need to extrapolate from those millions of documents, and just use the things that's pertinent to you and what you are supposed to do and go from there. Sounds simple, right? Now, first time during my first week and still up to this date, it is super overwhelming. You are always, I was always scared that I will miss some important information and I will screw up the patient's health, which I definitely don't want to do, right? And I'm still struggling with this because there's so much information that you need to synthesize from that, it just takes forever, and it's kind of overwhelming. I'm getting better at it. I'm not the first one that got overwhelmed, and I won't be the last one, but I just wanted to get you guys ready to be ready about the amount of information that you are going to be thrown upon. Number 4, get ready for some incredibly challenging document synthesizing. Now, the 5th and the last thing that surprised me was the amount of negotiation that you have to do with your patients. And that's, I think, I wouldn't use the word frustrating, but that is something that was obviously very, very surprising to me, because I understand that the people that are in the hospital, not many people really are in the hospital because they enjoy being there, right? And most of them are going through some type of traumatic event and a life-changing event. And it's very hard to convince them, to do therapy with you. And you have to respect that and not take it personally. And sometimes they see you and their first reaction is like, ugh, I don't want to do anything. It happens, right? And I was pretty surprised, regardless of how ready I was and regardless of the fact that I know what's going on. But it's just coming from outpatient clinic, where patients are happy to see you, where patients are willing to put the work and effort in. When they are in outpatient, maybe because they are in so much pain, maybe because they have been thinking so much about their life, or any reason, they just don't want to work with you, most of them, okay? I would say at least 50% of them don't really want to work with you. And it can be surprising, and it can be, at least I was surprised, and it can be overwhelming, and it can be sad at the same time, because that they really need to move, because like everyone knows, studies have shown lying in a bed for a prolonged period of time, any period of time, is really bad for you. You lose a lot of muscle, you lose a lot of GI motility, and everything goes downhill. But explaining that to the patient sometimes could be very, very difficult and a challenge. And that really surprised me, even though I knew that, right? So those are the top 5 things that I got surprised with. There were some things that I kind of knew but didn't really appreciate the magnitude, and there were some things that didn't even come to my mind, like putting on a full sleeve. I hope that you guys learn something from my experience, and you guys wouldn't make the same mistakes that I did, or at least improve, or at least have a better expectations of your first day on your clinical. Now, this video is in no way, shape, or form is a critique on a hospital or my CI or my school. It's just a learning experience that I wanted to share with you guys, and that's about it. I am in a great school. I am doing my internship from a great CI in a great hospital. I have no complaints. These are the things that were my limitations, right? And I just wanted to say this to you, that regardless of what, it's going to be overwhelming, but you will get through this, because I am not the first one that got overwhelmed on the day 1, and I wouldn't be the last person to get overwhelmed on the day 1. I'm pretty sure my instructor got overwhelmed on her day 1, and it's just a process of learning, right? And I want to leave this video by saying, all we need to do is keep trying, keep showing up, and we will be successful as long as we are putting effort into this. That's it for this video. Hopefully, again, this video was helpful. I will try to give you guys updates as much as I can, but obviously boards are in the way. I'll try my best. Until then, see ya. Bye.